time for Live Well. When you hear the term palliative care, we often think about it as in the context of aging, right? Like old people, and we only think about like very sick people as very old people. So when you do go to most palliative care places, you will find quite a lot of old people because we think like, aging and that part of your life is only reserved for those. Unfortunately, there are so many things that can land one in palliative care, and sometimes there is young people that end up in states that require palliative care. We'll be exploring youth-centered palliative care, something that's not so great to think about, to speak about, because we want the young people to have long and fruitful lives, but unfortunately it doesn't always work like that. We'll be chatting about youth-centered palliative care in this hour of the show.
Hey, remember, we do have a new website. It's been updated for you. It's where you can get the full experience right here on Channel Africa of what we do on air, but also what's happening on the various parts of the continent news-wise. So this is where we collate everything and we put it in one place, and it's for you to have that African experience of the African perspective. So go to our website, www.channelafrica.co.za, and experience what Channel Africa is all about. Right now, let's go back to the music. This is Adekunle Gold with Sena featuring Lucky Day.
Get Channel Africa on DSTV Audio Bouquet. Channel 802.
Loving you be my greatest sin. Said I was done, but see I'm here. You don't make it easy, rara, to stay away from Yawa. Shiba, oh Shiba, girl you make me sinner. Shiba, oh Shiba, no make me pull the trigger. Never say never, no I can do whatever. For Shiba, oh be mine, don't wanna be so loser, no. Drunk on your potion, can feel my lips burning, losing composure. Can feel my face drowning, seems so irrational. Ready to risk it all. If I can't have you, nobody can. No. Tell me how can I get my mind off you?
It's 10 minutes past 11 Central Africa time. Adekunle Gold and Lucky Day on this one is titled Sinner. We're about to speak about youth-centered palliative care. Stay with us.
The Morning Switch Weekend with the Shy Guy.
The story that takes us to Zambia. There are two men actually that were sentenced to prison for the plot to kill the president with witchcraft. You go like, what? So these guys were arrested actually in Lusaka, and what was found on them was a live chameleon. Can you believe that? Animal tails and bodies of concoction. That law takes us back to 1914, which is the Witchcraft Act. I can imagine now arrested and they go to jail for the next 2 years. I presume that you get to jail, they get to ask you actually, what is it that you committed? Now this is the first of its kind, by the way, for somebody to be arrested for such. They in Pemba, whenever they pass, hey, Chikanga, hey, Uloya, hey, Mulosi. And imagine here I am in these early hours of the mornings, I get to talk about witchcraft.
Saturday and Sunday mornings belong to the Morning Switch. 3 to 6 a.m. Central African Time. Madapiri Bazoshitika. Madapiri Bazoshitika.
Mafuta galimoto akwera mtengo mdziko la Malawi ndipo nkhani anthu ayilandira mosiyana-siyana ndipo mtu ankhani mdziko la Malawi kondwani Nyamasauka tili naye pa line pano kuti atifotokozere zambiri. Kondwani kodi uli bwanji? Mafuta galimoto kodi akwera kufika pa bwanji?
Mafuta galimoto akwera amene tuyankhula pano kukamba onena kuti usiku wathawu petrol wakwera kuchokera pa 2,530 kwacha kukafika pa 3,499 kwacha. Koma nkhani ya mapercentage ndi 38.30%. pamene dizilo wachoka pa 2,734 kwacha kukafika pa 3,500 kwacha, yomwe ikuyimira kuma percentage a 28.02%.
zochitika pa nthawi ya 6 koloko kufikira 7 koloko madzulo, lolemba mpaka lachisanu ndi madapiri. Palesa and Benjamin fuel your day with fresh African perspective on Channel Africa.
It's time for Live Well right here on The Move. You know, we think about life as this wheel that turns until it doesn't turn anymore. Usually when we become older, that's what we're thinking, right? That when people become older, then they can no longer take care of themselves, or they get, certain illnesses, then they go into palliative care. And palliative care is often spoken of in the context of aging, yet so many of its most complex stories belong to the young. From cancer and HIV to rare genetic diseases, their needs sit at the intersection of healthcare, mental health, and social identity. Palliative care for youth goes beyond end-of-life treatment. It's also about helping young patients live fully, to manage pain and find dignity in the face of uncertainty. So that's what we're exploring today, how youth-centered palliative care can redefine what it means to live well with illness. Joining us on the line is Dr. Samantha Govender, who is the Chairperson of Palliative Care for Children South Africa, also known as PatchSA, and a pediatrician as well. Dr. Govender, thank you so much for your time. Good morning.
Good morning, Palesa. How are you?
Oh, doing great. Thank you. How are you?
I'm good, thanks. And thank you so much for this wonderful opportunity.
All right, for those who might be hearing this term for the first time, I think maybe they've heard it described in many other ways. Let's start there. What is palliative care?
So it's known as children's palliative care as well as pediatric palliative care. So children's palliative care has many different similarities to adult palliative care. And when you talk about palliative care, it's an active, holistic approach to caring for children, youth, adolescents, and adults with life-limiting or life-threatening conditions, as well as their families. It focuses on improving quality of life through the conditions and the journeys that the children and the families are journeying through. And we mainly focus on prevention and relief of suffering. And suffering is not only seen as physical, it's seen as social, spiritual, emotional, and psychological suffering. And children have some life-threatening conditions and rare diseases that are not seen in the adolescent as well as in the adult population. So their disease trajectories and responses to treatment differ significantly from adults.
I see. Dr. Govender, even though in your definition you're saying, hey, everybody, right, children, the youth, and all the way to adults can access palliative care. But in our heads, we think palliative care is only for the aging because, we have that social construct, right, that we want to live long and fruitful lives. And perhaps at the end of our lives, that's where we're more susceptible to diseases. That's where we're more susceptible to, life-threatening illnesses. And then we go into palliative care. So nobody thinks about or wants to think about young people being in a position where they will need palliative care. It's both, right, physical, but there's also that psychological, thing that we have to get over when it comes to young people needing palliative care. Chat to us a little bit about that.
So, it's strange that you talk about when people associate palliative care only with aging. I'm just going to give you some perspective because it's not only about aging, because somebody can get a life-threatening or a life-limiting diagnosis or an illness at any point of their lifetime. Example can be an unborn baby, where the mom and the dad are told that your child has this lethal condition that is incompatible with life, and that we need to either terminate the pregnancy, or if the parents choose not to terminate the pregnancy, how do we do a birthing plan for this family who have chosen to have this little one being delivered, knowing that there's a possibility that this little baby may not be living for more than an hour or 2 hours or weeks or months? So it's across the board, Palesa. And people forget that it is supposed to be initiated at the time of diagnosis, when physicians, surgeons are aiming at curative treatment. Either it's medical or it's surgical treatment that they want to achieve. But palliative care is also for everybody across the board. What about an elderly person who has had how can I explain the example? A stroke, and now he's quite ill and they are bedbound and they can't do certain things. We need to incorporate the principles of palliative care when you are talking to those families and bringing them into it. And palliative care is not only just for the patient. We have to remember that a patient is a family unit. You have siblings, you have parents, you have grandparents. So we try and incorporate everybody into that palliative care circle when you're caring for a family and for a patient. And people forget that. It's holistic care. There's so much more that you can do for a patient and the family. And that's the term that we rather say than saying, you come to a point to say to a family, I'm so sorry, there's nothing more we can do. People need to start using the terminology, there's so much more that I can do for you and your family.
Mm-hmm. Dr. Samantha, let's talk a little bit about the examples of, the conditions that could affect younger people or even children when it comes to palliative care. Give us some examples.
So when majority of the time when people talk about palliative care, I think everyone will assume that you're related to cancer. Mm-hmm. And that's okay because people don't know. And we are here to help you understand.
Sure.
So for me, when people talk about palliative care, yes, it includes cancer. But there are a lot of other things like you've mentioned already, people with HIV and AIDS. There's also children who have Down syndrome that have a heart lesion that is inoperable and they can't have heart surgery. So then they have heart failure with lung failure. They are needing palliative care. We have children and adolescents with muscular dystrophies. They are needing palliative care. For me, when I see patients in my setting also, you can have a child that came to us with a simple thing as a headache and a fever and vomiting. And then you find out that this patient has a meningitis, which is like an infection of the covering of the brain. But then there's complications to that meningitis. They have seizures. Then their development is affected. And that patient now has progressed into their meningitis. And let's say they have TB meningitis and they've got stage 4 TB meningitis. They become children who have cerebral palsy. They have complications that need to be attended to. So that's also a child that needs pediatric palliative care.
Yeah.
There's
Would the care in itself look differently for children than it does for an older generation?
Yes. The care in a way is different because, as mentioned, their disease trajectory is different to an older patient. Their treatment protocol is also different. And in children, we always do medication according to their weight. I can't prescribe 1 tablet or 2 tablets. It has to be weight prescribed. Also, their symptoms and their, how can I explain, or their challenges that they face may be a little bit different to an older child or an adult. Because remember, a child, it's age appropriate communication talking to this child versus you talking to an older child, an adolescent who may understand you better versus a 4-year-old and a 5-year-old. You also have to talk about, you remember, they are going to school. They're going to be missing out of school. They have things that need to be cared for other than when you compare them to an older child and an adult.
All right, Dr. Govender, stay on the line. We still want to speak about youth-centered palliative care and some of the things that are quite specific that would be needs for young people who have to go into palliative care. We'll continue this conversation with Dr. Samantha Govender after this break.
Africa, meet Abedi.
Yeah, that's me.
Abedi is a music lover through and through.
I really love African music.
He's got a taste for all kinds of tunes and spends his days listening to Channel Africa. Guess what? He didn't know.
Okay.
Channel Africa wants to help Abedi and all music lovers everywhere to discover even more incredible music. That is why Channel Africa is calling on all African musicians to submit their music. Musicians, remember to give us all your relevant information. Make your submissions at music@channelafrica.co.za. Submissions are your chance to be heard on radio. But sadly, they do not guarantee that you will be playlisted. All submissions will be carefully reviewed to see if they meet our station's requirement. Channel Africa, the African perspective. Hashtag on the move and connect with us.
Hey, we're speaking a little bit more about a specialized treatment for very serious illnesses. This is what we call palliative care, and we're speaking to it around palliative care that's for maybe a younger generation, maybe someone who is a young teenager, or maybe someone who's an infant or a young child. Dr. Samantha Govender is speaking to us, Chairperson of Palliative Care for Children, South Africa. Dr. Samantha, you know, palliative care can feel like it's almost exclusive in its nature because it deals with serious conditions. And in many African countries, the issue is access to medical care. Does this make it more difficult to actually treat people who need this more specialized type of medical access?
When it comes to the specialized care, Benjamin, palliative care can be initiated in every institution, provided we give them training, education, and resources. So it's accessible, but the access to get it out there is a challenge. The availability of children's palliative care services, including adult and youth-focused palliative care services, is very limited across the African countries. There are some countries where it's concentrated in urban centers versus you going into the rural or the more district or the countryside where people actually need it. There's only a handful of countries that have established children's palliative care programs. And to name a few, we've got South Africa on the list, there's Uganda, there's Kenya, we have Malawi, Zimbabwe, Eswatini, Zambia, Nigeria, and Namibia. But South Africa is the only country in Africa that has a dedicated national association for children's palliative care, which, as you mentioned, is PatchSA. And we need to start integrating it into the national health systems. And there need to be policies, but policies are still inconsistent. And that is a challenge. South Africa does have a policy, but it's expired before it's implemented, but we're working on a new one. So it is a challenge. And then people, when you talk about palliative care, even healthcare workers are afraid to actually offer this concept of care to their patients because, yes, it is associated with death, but we don't know when death is coming. That's not predicted by us. But that is why you have to offer this family this opportunity of palliative care to live their life to the fullest. And looking for symptom relief, trying to make that journey more comfortable in the time that you have with them. So educating people, teaching them, doing short courses, training at hospitals, getting that information out there will make people more equipped to handle families with palliative care needs.
You know, Doctor, you speak about still being able to live your life to the fullest, and that's what we expect from young people, right? We expect them to be lively, and even when they're ill, they are still young and they still have that heart of a child. So what are some of the main priorities, right, when young people begin palliative care to also help them not just be comfortable, but to somewhat still be young?
It's a challenge, Palesa, because a young person is transitioning from childhood into adolescenthood into adulthood, and they have their own specific needs and challenges that they need to go through. And here you are telling this child, I'll give an example, maybe a 14 or a 15-year-old that you have a condition that is life-threatening or life-limiting. This child and this family had all their hopes and dreams. He wanted to be a soccer player. Now he can't walk and he can't get out of the bed. Nobody knows that pain except that child and his family. And our focus is mainly on relief of pain and suffering and distressing symptoms. The main thing in an adolescent child is to try and build trust with that child. We can't just go into that home or that room and impose all our wishes and demands on them if we haven't actually felt and understood who this person is really. You need to build trust with the child, the family, as well as the care team. We have to assess the emotional, social, and spiritual needs, as well as their educational needs. You have to support the parents, trying to make them realize this is an adult, this isn't an individual. They need to know what's happening with them. You have to tell their child what's wrong. But many parents are scared because they don't want to burden their children with this diagnosis. They feel that if you tell the child will be sad. But there's so much things that you can do when you bring that child into the team and helping them understand the illness and the care plan. Young children and young people have better innovative ideas, and sometimes it may work for them. And you have to try and maintain a normalcy, encouraging school, play, as well as peer connections. And sometimes by just giving that child or that youth the information that, I have this problem. Many of our children have access to social media.
Yeah.
They can Google, they can check, they can share their stories, and they can realize that there's someone else going through the same thing as me.
Yeah.
And they guide inspiration from that.
Sure. At times there are unique circumstances whereby the palliative care is not only for the child, but also could be simultaneously also going to the parent. In situations such as that, how do you deal with having a comprehensive approach there?
For me, what people need to understand that when you're dealing with a patient and family with palliative care, it cannot be done by one person. You need a team of people because you have to assess a whole family's needs. And that team includes the child, the parent, the adult who's got a palliative care diagnosis, or the adolescent who has a palliative care diagnosis, including the doctors, nurses, and the allied health. By bringing them into that team and making them understanding what is really wrong with them, what can be done for them, and where we are and how they can play a role in their care plan, it's a huge impact for them, and they become part of that person. You see a whole different concept of a family when it involves them. So shared decision making is very important. But sometimes we fear bringing the family or the person into that team, not realizing by not bringing them into the team, we're actually creating more harm.
All right, we have to leave it there. Unfortunately, we've run out of time, Dr. Govender. If we want to find out more about the palliative care for children South Africa, where do we go?
So they can visit our website, which is www.patchsa.org, and they will have a lot of information for anybody who wants to actually access or understand palliative care. We also have a Patch Academy where we have courses that are on it, and that website is www.academy.patchsa.org. We have a free or should I say, Introduction to Pediatric Palliative Care. It's an online course, and that's a free course. So people can join, they can attend it, they can do it as they please in their own time, and they can learn so much more.
Okay, we have to leave it there. Thank you so much, Dr. Govender. It's always good speaking to you on these matters. It's great having you back here on Channel Africa. Thank you for joining us.
Thank you so much. Take care.
That's Dr. Samantha Govender, Chairperson of Palliative Care for Children South Africa, also known as PatchSA. Well, that conversation takes us to 11:31 Central African Time. Let's keep things moving and wrap up our morning sports.